Welcome to the system workflow tutorial for the home health patient tracking system. This video is detailed. You can watch it anytime from the dashboards, but this will give you an overview of how the system flows together. At this time, our focus is on the OASIS-c form. It is free of charge. However, we are planning on adding forms for all these different areas listed below. Also, if you have custom forms, they can be added to your system as well. We are accepting all home healthcare forms. If you have other forms, you can email them to us or fax them to us. We want to know about all forms in our industry. Dashboards and features. There are 5 different dashboards based on user type. Notice how the feature icons change for the different user type. The branch dashboard has all features available for the business. This is the doctor dashboard, the nurse, the manager, and it has all the same icons as the dashboard. Users only have the icons for functions they have access to select. Let's look over some of the buttons and features on the dashboard. There's the log out button. The system will time out automatically if you don't have any activity for a certain amount of time. The notes overlay. You can look at the notes video for information on using notes. The people lookup. You can look at the create user video for information on that. The calendar that is also reviewed in the notes video. The patient visits and notes. Nurse visits and notes. Manager visit notes. We also call these the information views. The Google Maps and route, and with the GPS check-in and check-out. This is reviewed with the notes and the calendar in a tutorial video. This is the form for data entry on visits. These icons are for future functions. At any dashboard, there's an online chat, and if someone is not available, you will be given the opportunity to send an email for technical support. To start a new visit, you click on the green Start a New Visit button. When you're viewing records, you can use this drop-down box to show open or needs edits or reviewed or closed. Online video training is available with the help icon throughout the system. If you wish to edit one of the scheduled visits, you click the little edit button. This is the status of the forms, if it's been reviewed, if there are edits necessary, if it's closed. And this is the form that's been assigned for this visit. If you have multiple forms for a visit, you will double book the same visit because each visit has one form connected to it. The visit form workflow. We're going to review the reviewing and the edits and the locking of forms. First, let's look at the way data is spread across the OASIS-c form and the form paths. There are 2 methods of viewing the data. So I want you to remember we're going to look at 2 different ways of viewing the data on the OASIS-c form. The form sections. If you look at the beginning of the OASIS-c form, you'll recognize this section. When you look across the OASIS form, looking across the 24 pages, you'll see that it's broken down into different health areas. Patient tracking sheet, sensory status, cardiac, etc. And within these different health sections, the information is spread across randomly, practically, across all of these different M codes across the system. Now the OASIS form wants to be filled out as far as outcome and assessment information set. This is the left side of that first part of the OASIS form. The start of care, resumption of care, follow-up, transfer to inpatient facility, discharge for death at home, and discharge from agency. This is the most efficient way to enter data into the OASIS-c form. We call them data paths. So we've simplified the data entry to follow these paths. This data entry is also very compatible with smartphones, tablets, and desktop computers. Managing the form. So from a branch, we've clicked on a visit date, and this brings up the visit form. Going back to the 2 ways that we look at the data, there are the form sections, and then there's the outcome assessment information set. And notes are only attached to visit forms. They're available as an icon throughout the system, this form has 7 notes attached. So if we click on the form sections, we see the different health sections of the form. Again, like patient tracking, sensory, cardiac. Now here I want you to look at the dashed line. What we've actually done is we have said for this visit we want to do the resumption of care. So if I click on the outcome and assessment information set, I see the resumption of care, only those areas for the resumption of care. If I change that dotted line for the complete OASIS form, you see the complete part of the OASIS form at the top. You notice that everything is blue. The blue color indicates that no data has been entered at this time point. If the section is green, then data has been entered at that time point. So back at the dashboard, to start a new visit, we will click the green Start a New Visit button. In the 3 columns that have the arrow in the middle, you can see if they are reviewed, if they need edits, or if they're closed. If you wish to edit a visit, you'll click the Edit button. This is how we change the reviewed, edits, and locking status of each form. If we want to go and enter data for a visit, we click the blue Visit Date. So I've clicked on the green button to start a new visit, and I'm at Add a Visit. You'll notice that there's nothing in this area. You'll see more about that in a moment, but we're adding a visit, so you won't be adding edits at this point. If I go edit a visit for an appointment that was previously entered, you will notice it will say Edit Visit at the top. This area has the flags for the workflow status. If it needs edits, if it's closed for billing, even if it's going to be deleted. Also, if you need to reschedule the appointment, this is one way to do it. This gray section has the View and Add Notes section. Again, there's a video tutorial showing more about how to add notes to an individual visit. This Update Visit button is only for the visit date. It's separate from the note visit, which is shown in the other tutorial. So if you make changes, you have to click this button to have those changes saved. Now we're going to go from the dashboard and start a new visit. Here we would choose the patient, nurse, manager, and doctor for this individual visit. We select the time and date. If you have additional forms that you've added, they will appear here. If you have additional forms which you've added for your branch, they will appear here. The 6 different OASIS form paths are selected by the drop-down box at this location. And then you hit the Create Visit button to actually save your work. Then you hit the button to create this visit record to schedule this visit. That appointment that you would have created would appear on the left-hand side. To enter visit data, we will click on that button. It brings up the visit form. To enter in data, we click here. This is for the resumption of care visit, which we've scheduled when we created this appointment. This is the resumption of care data entry screen. Touching a gray area on a touchpad or clicking on it will open up that section. You see the questions open up and can be closed as you click on each different gray section. A floating save button is always on the data entry screen. If you happen to be using this on a phone or a tablet, it will automatically resize to fit that tablet. This is an example of the start of care. The gray sections are all closed. If I click on the living arrangement, if this appointment was set for discharge from agency, for death at home, this form appears. There is not enough information on this screen to have gray sections, so everything appears on one screen. Printing the form. From the user dashboard, you click on the blue Visit button. This will bring up the visit form. And here is the completed OASIS form. So if you click on that, you get your form, and it's that easy. Visit form management for the view, edits, and locks. So again, from a dashboard, we can change the view of the records that we see by changing the select button. I can indicate I only want to look at flagged for review or flagged for edits, closed, all records, or deleted. If I want to make changes or change the status, I click the Edit button to the side of the visit record, or I can click on the blue button and go to the visit record and click the Edit Visit Record button at the top. It will bring up this screen. You can set edits needed to have the caregiver make corrections, then use the notes to indicate what data should be reviewed. After edits have been made, set that flag for manager to have the manager confirm the corrections. And when all the work is done, you can close the form for printing and billing. If you want to delete this record, you can mark it as deleted. Again, the information will remain in the system, but it will be hidden unless you look for deleted records. Again, at the top, if you want to add notes to this visit record, since it has already been created, you click the gray View and Add Visit Notes. And remember, you must click the Update Visit to have anything you change saved. So you're ready to use the system. The purpose of this overflow is to present the screens, the organization, workflow, and features. Use of the OASIS system is intuitive and free. Play around. We've tried to make complicated easy. Again, no data can be deleted from the system. Items can be marked as deleted to remove them from the view. However, all edits and everything in the system are always remaining. This completes the system screen workflow. Thank you.